Most heart attacks don't come out of nowhere. Your body has been warning you for years, even decades, and almost nobody is catching the signs. Not because doctors don't care, but because the system isn't designed to look for them. I've seen patients with perfect test results, who ended up needing bypass surgery just 2 years later. So I started asking one question: what are we missing? I'm Dr. Ava Harper. I've spent 20 years as a preventive cardiologist. And over time, I noticed a pattern that didn't make sense. Patients would come in with normal cholesterol, acceptable blood pressure, clean EKGs, everything looked fine, on paper. But in reality, their arteries were already silently deteriorating. And by the time symptoms showed up, it was almost too late. That realization changed everything for me. Here's what nobody tells you in a standard 15-minute doctor's appointment: heart disease doesn't start in your heart. It starts quietly, in your blood vessels, your gut, your sleep patterns, and your immune system, sometimes as early as your 20s and 30s. By the time your cardiologist sees something alarming on a scan, the disease has often been brewing for 15 to 20 years. The tragedy is not that we lack the tools to catch it earlier. The tragedy is that we're not using them consistently enough, and patients don't know what to ask for. Let me be empathetic here, because I know how frustrating this can be. You go to your annual physical. You do everything right. You get your blood work done, you answer the questions, you listen to the doctor's advice. And you walk out feeling reassured, safe, taken care of. And then something happens: a heart attack, a stroke, a diagnosis that feels like it came out of nowhere, and you are devastated, because you thought you were being careful. If that's happened to you or someone you love, I want you to know, you are not failing. The system was failing you. And it's time to change that. Now let's talk about the 10 signs that are almost universally overlooked, and what they're actually telling us about your cardiovascular future. The first sign is something almost every adult has experienced but rarely connects to their heart: gum disease. I know, it sounds strange. But the same bacteria responsible for chronic periodontitis, that persistent inflammation of your gums, have been found in the plaques lining coronary arteries. A landmark study published in the Journal of the American Heart Association found that individuals with moderate to severe gum disease had a nearly 50% higher risk of cardiovascular events. The mechanism is elegant and terrifying. Bacteria from your mouth enter your bloodstream through inflamed gum tissue, trigger an immune response, and contribute to arterial inflammation. So when your dentist tells you that you have gum disease, your cardiologist should probably know about it too. If you have bleeding gums, chronic bad breath, or receding gum lines, don't just schedule a cleaning, tell your doctor. The second sign is one I see constantly in younger patients who dismiss it as stress or anxiety: resting heart rate variability. This is different from your resting heart rate. It's about the variation between each heartbeat. A healthy heart doesn't beat like a metronome. It has a natural, subtle fluctuation that reflects the balance between your sympathetic and parasympathetic nervous systems. When that variability drops, when your heart starts beating too rigidly and mechanically, it's a sign that your autonomic nervous system is under strain. Research published in the European Heart Journal has consistently shown that low heart rate variability is one of the strongest independent predictors of future cardiac events, even in people with no traditional risk factors. You can now measure this at home with a smartwatch or a simple fitness tracker. If your HRV has been chronically low, that's a conversation worth having with a physician who understands it. The third sign is one that tends to provoke eye rolls until I explain the science: erectile dysfunction in men under 60. This is not a topic most men bring to their cardiologist. They bring it to their urologist, or they quietly order something online, or they just live with it. But erectile dysfunction is, in many cases, a vascular problem masquerading as a sexual problem. The penile arteries are among the smallest blood vessels in the body, and they are among the first to be affected when endothelial dysfunction, damage to the inner lining of blood vessels, begins. Think of it like a canary in the coal mine. If those small vessels are struggling, the larger coronary arteries may not be far behind. Studies have shown that men with ED have a 45% higher risk of cardiovascular events compared to those without. If you or your partner is experiencing this, please bring it up with a doctor who won't just hand you a prescription without also ordering a cardiovascular workup. The fourth sign is something millions of people live with and are told is simply the way they are: chronic fatigue that doesn't improve with rest. Now, fatigue has many causes: thyroid issues, anemia, sleep disorders, depression. But one underappreciated cause is subclinical heart failure, a condition where the heart is beginning to lose efficiency before any dramatic symptoms appear. When your heart isn't pumping as powerfully as it should, your muscles and organs receive less oxygen. Your body compensates for a while, but eventually that compensation shows up as persistent tiredness, difficulty climbing stairs, or feeling wiped out after activities that used to feel easy. If you've been brushing off exhaustion as aging or overwork, and your standard blood work keeps coming back normal, ask your doctor about a BNP test, brain natriuretic peptide, which is a simple blood marker that can reveal early signs of cardiac stress. The fifth sign involves your ankles, and it's surprisingly easy to notice if you know what to look for. Edema, swelling in the feet and ankles, is often chalked up to standing too long, wearing tight shoes, or flying on a plane. But persistent ankle swelling, particularly when it's worse in the evening and improves overnight, can be an early indicator that your heart isn't handling fluid balance efficiently. When the heart's pumping capacity begins to decline, even subtly, fluid backs up in the lower extremities. Press your fingertip firmly into the inside of your ankle and hold it for a few seconds. If it leaves a dent that takes a moment to bounce back, that's called pitting edema, and it deserves medical attention. The sixth sign surprises almost everyone: sleep apnea. This is far more than a snoring problem. Obstructive sleep apnea causes repeated drops in blood oxygen levels throughout the night, and each of those drops triggers a surge of adrenaline and a spike in blood pressure. Over months and years, this cycle damages arterial walls, disrupts heart rhythm, promotes inflammation, and dramatically increases the risk of atrial fibrillation, hypertension, and coronary artery disease. A meta-analysis in the journal Chest found that untreated sleep apnea roughly doubles the risk of fatal cardiovascular events. If your partner tells you that you stop breathing at night, or if you wake up exhausted despite 8 hours in bed, please pursue a sleep study. A CPAP machine is not a glamorous prescription, but it may be one of the most powerful cardiovascular interventions available. The seventh sign is found in your eyes, literally. The blood vessels in the retina are among the only vessels in the body that a doctor can observe directly without any invasive procedure. During a comprehensive eye exam, an ophthalmologist can detect changes like arteriovenous nicking, copper wire arteries, or retinal hemorrhages that are often signs of hypertensive damage or early atherosclerosis. There is now emerging research using artificial intelligence to analyze retinal images and predict cardiovascular risk with remarkable accuracy, sometimes better than traditional risk calculators. If it's been more than 2 years since your last full eye exam, make that appointment. And ask your eye doctor specifically whether they see any vascular changes in your retina. The eighth sign is a pattern in your blood work that most doctors glance at and move past: a persistently normal LDL cholesterol combined with chronically elevated triglycerides and low HDL. This triad, which researchers call atherogenic dyslipidemia, is associated with small, dense LDL particles that are far more likely to penetrate arterial walls than the larger, fluffier LDL particles that a standard cholesterol panel measures. Here's the critical point: your total LDL can look completely normal while these dangerous particles are doing damage below the radar. Ask your doctor for an advanced lipid panel, specifically LDL particle number and size, apolipoprotein B, and Lp(a). These tests cost a little more and aren't always covered by insurance, but they offer a fundamentally more accurate picture of your cardiovascular risk than the basic lipid panel alone. The ninth sign is one that lives in your gut: chronic, low-grade inflammation. We now know that the gut microbiome plays a significant role in cardiovascular health. Imbalances in gut bacteria can increase the production of a compound called TMAO, trimethylamine N-oxide, which promotes arterial plaque formation. Beyond that, a leaky gut lining allows inflammatory compounds to enter the bloodstream and drive systemic inflammation, which is one of the root causes of atherosclerosis. While your standard doctor won't order a gut microbiome panel, there are indirect clues: chronic bloating, irregular digestion, a diet low in fiber and rich in processed foods, that suggest your gut environment may be contributing to cardiovascular risk. C-reactive protein, or CRP, is a blood marker for systemic inflammation that is inexpensive and widely available. A high-sensitivity CRP above 3 mg per liter is a meaningful red flag that should prompt further investigation. The 10th sign is perhaps the most commonly dismissed of all: shortness of breath during mild exertion. Not the breathlessness of sprinting upstairs, I mean the kind that catches you off guard when you're walking across a parking lot or carrying groceries. This symptom is one of the most underreported in medicine, particularly in women, who are more likely than men to present with atypical cardiovascular symptoms and are far more likely to have those symptoms attributed to anxiety or deconditioning rather than cardiac causes. If you are getting winded during activities that shouldn't wind you, and it's a change from your baseline, that is your body asking for a closer look. A cardiopulmonary exercise test, known as a CPET, can reveal early cardiovascular limitations with extraordinary precision. Now let me give you a practical roadmap. Because knowing these signs is only useful if you know what to do with the information. First, become an active advocate in your own care. Bring a list to your next appointment. Ask specifically for high-sensitivity CRP, a complete lipid particle analysis including a polypoprotein B and LP, a BNP or NT-proBNP level, and a fasting insulin level. These are not exotic tests, they are clinically validated, available in most labs, and together they paint a far richer picture of your cardiovascular health than the standard panel. Second, address the lifestyle factors that drive inflammation and vascular damage, because these are where prevention happens. Sleep is not optional, it is where your cardiovascular system repairs itself. Aim for 7 to 9 hours of quality sleep, and take sleep apnea seriously if it's suspected. Eat a diet built around whole foods, fiber, omega-3 fatty acids, and polyphenol. Not because it's trendy, but because these foods reduce inflammation, support the microbiome, and directly protect endothelial function. Third, if you have any of the signs I described today, consider finding a physician who practices preventive or functional medicine, someone who is comfortable ordering advanced testing and thinking about your cardiovascular risk on a 10 or 20-year timeline rather than just reacting to what's in front of them today. Integrative cardiologists, preventive medicine specialists, and some forward-thinking internists are out there. You may need to search for them, but they exist, and they can change your trajectory. Fourth, track your numbers over time. A single measurement tells you where you are today. A trend tells you where you're going. If your resting heart rate variability is dropping month by month, or your CRP is slowly creeping up, that directional information is invaluable. Use technology to your advantage. Wearables, home blood pressure monitors, and regular lab panels are your early warning system. Fifth, don't let embarrassment or normalization stop you from reporting symptoms. Fatigue, swollen ankles, shortness of breath, erectile dysfunction, sleep disruption. These things are so common that we've begun to think of them as normal features of aging. They are not. They are signals. And signals exist to be read. The science supporting early cardiovascular prediction is not fringe. The MESA study, the multi-ethnic study of atherosclerosis, followed over 6,000 participants for more than 15 years and consistently demonstrated that advanced markers like coronary artery calcium scores, LPA, and inflammatory markers predicted heart disease years before traditional risk calculators did. The Jupiter trial showed that treating elevated CRP, even with normal LDL, dramatically reduced cardiovascular events. And the CANTOS trial demonstrated that targeting inflammation directly, independent of cholesterol, reduced heart attacks. The paradigm is shifting. The evidence is there. And you deserve access to it. I want to leave you with this thought. Heart disease remains the leading cause of death worldwide, not because we lack the knowledge to prevent it, but because that knowledge isn't consistently reaching patients before something goes wrong. You are sitting here right now, which means you are someone who is paying attention, who wants to understand their body, and who is willing to ask harder questions. That puts you ahead of the curve. The decisions you make in the next 6 to 12 months, the conversations you initiate with your doctor, the tests you ask for, the habits you reinforce, could genuinely determine whether you're watching your grandchildren grow up or sitting in a cardiac rehab unit wondering what you missed. You now know what to look for. You know the questions to ask. And you know that a normal checkup is not the same as a thorough one. Share this video with someone you love, a parent, a sibling, a friend who keeps brushing off their fatigue or their swelling or their restless sleep. Leave a comment below telling me which of these 10 signs surprised you the most, or share your own experience navigating the healthcare system when something felt wrong but the tests kept coming back fine. Your story might be exactly what someone else needs to hear. And remember, your heart has been working for you every single minute of your life. It's time to return the favor.